Hi, everybody. This is Kara with Senior and Disability Services, and I wanted to go ahead and show my screen, and welcome you to our provider info share session. Few of us are still joining, so we'll just take a minute or two here at the beginning of our session to introduce ourselves or reintroduce ourselves to you. We do have a new team member here with us in training, so I wanted to make sure that you get a chance to say hello. Again, I'll just let you go for it. I'm Kara, Senior Disability Services Training Unit Manager. Go ahead, Anna.
Hi everyone, my name is Anna Williams and I am with SDS and I work on the Living Well grant.
All right, go ahead, Cassandra.
Hi everyone, I'm Cassandra Lynch and I am one of your training specialists.
Kat, go ahead.
I'm Kat Zavala-Pinskus and I am the care coordination support person and I also do the provider office hours.
Okay, and Damon, go for it.
Hello everyone, my name is Damon. I'm with SDS Training, brand new, so I'm excited to be here.
Thank you so much, Damon. We're so glad that you're with our team too. So today is our provider info share where all provider types are welcome. So we also have another team member joining. Of course, that's Delight Mills, another of our training specialists. So I'm guessing that most folks here are probably familiar with our team. But anyway, I'd like to learn a little bit more about who I have here in the session, if you would. On your control panel, you can see a few different things you can do as an attendee. One of the things that you can do is raise your hand. If you see a little hand that's inside of a circle, you can go ahead and hit that hand and raise your hand for me so I can sort of take an informal count of what provider types we have. All right, so first what I'm going to do is I'm going to lower all the hands. So you might see something that said that, you know, the instructor lowered the hands or something. So I would like to know how many the waiver providers we have, waiver services. Go ahead and raise your hand for me if you would. Okay, great. Probably about a third of us are waiver providers, so welcome to you. All right, I'm going to lower those hands. And if you are a care coordinator, if you could hit that hand for me, that would be great. And a few care coordinators here with us. Welcome to you. Awesome. All right, I'm going to lower the hand. Personal care services providers. Okay, good breakdown here. Thank you so much. And anybody I didn't mention doesn't mean that you're not important. You're very important. It's just that there's only so many services I can remember at once. Everybody got a chance to raise their hand though, right? Okay, awesome. All right, so I'm just going to jump in. Let me move something around here on my screen so I can see things. Also, I want to ask my team here to jump in as well. I'll ask for your input and your sharing. As always with these, the info shares that we do, you are more than welcome and encouraged to go ahead and write to us in where you can enter text. So you'll see on your control bar, there should be an open spot where it might say chat, or it might say questions. So either of those places, you can go ahead and chat to us or write us a question, and we'll keep that open so that we can see your questions and your communications there. Even though you have entered in a muted status, meaning this is the type of webinar where our attendees aren't able to share audio, go ahead and write your thoughts to us. We can keep a record of those, a report of those, so we can always respond as needed. And it's just nice to hear from you and to know your questions. We can respond to them here in the session. If we don't have time to answer all questions, just know that we do have them recorded and we can put together further opportunities to get information out to you. Likewise, if this is a short session, if you don't have a lot of questions, that's okay too. No, we're not, mandatory to stay in the session for an entire hour as long as we have our discussion taken care of. And we're here for you with these sessions. So it's just a way to establish contact and get information out to you. So I'm showing a pretty simple agenda. We wanted to talk about a few things today. First things first, our SDS Training Academy. I wanted to remind us, or perhaps if you haven't heard of it before, to announce it to you, that we do have an online training academy. It's called the SDS Training Academy, and the website is right here, SDS training at ethinksites.com. You won't be able to, click on that because it's in a webinar display, but maybe you could jot it down. And if you have not already gone to that, consider going there and signing up for an account. All right, so you get an account, and then once you're in the account, that's your user account, that's your learning account, you can take the following trainings: critical incident reporting, home and community-based settings, and mandatory reporting. These are the 3 that we have open to everybody. So you can go back and take those. You can take them again if you are due for those, and then if you're not due for them now and you become due for them, you can go in and take them there. The nice thing about the Academy is that you will receive a certificate of completion right when you finish. So it'll give you a link to download one, or it'll give you an email to go to follow to get one. You can download it from an email. So that's been good. If folks try it and there are problems, if you encounter any difficulties with it, then please just email us at sdstraining@alaska.gov. We are eventually going to be doing all of our trainings and all of our learning opportunities for our providers and even for our staff through our academy. So we highly encourage you to go ahead and sign up. It is one learner for each account. So if you're in an agency, you don't have an agency account, each person can have their own account, and that's the way it works, right? So it's not the kind of situation where it's managed by an agency. It's just have your staff sign up. As always, our critical incident reporting training is targeted towards our program admins and their dedicated training staff. So other trainings that we're going to have come up: recertification regulation. We have some new regs that are either new or they were not in effect, or not required, or I should say enforced during or applied, I should say, during the pandemic or the public health emergency time. So we sort of have an interesting selection of different regulations to talk about here, which we will do through our academy. And I encourage you to go in and make an account and check back. If you need to be enrolled in a particular class and you don't see it, then you would just email us at sdstraining@alaska.gov and ask for enrollment in that. But our recertification regulation update, you'll see that come out before the end of April, and that will be available for anybody. And for care coordinators, it will count for continuing education hour. And then we have new classes in development, such as documentation of services. Eventually, we'll have a few levels of depth for documentation. So be on the lookout for that. And then, of course, our new regulations as they become effective. Flexibilities made permanent, meaning the public health emergency related flexibilities that are going to be ongoing past the end of the public health emergency. That they're in regulation, so that's how they're made permanent. And the day habilitation and supported employment regs, which formally came out but were not applied until the end of the public health emergency. So let me grab my other selection tool here. And I want to check our questions. So in case there's questions
No,
here.
we're good on the questions.
Okay, you're good on questions. Okay, awesome. So our next topic is awareness regarding harmony. A few things to think about harmony. Harmony is available to certain provider types as far as being a harmony user. Only our care coordinator community and our personal care services agencies have access to harmony. So there's an approval process or an application and approval process for that. And we want to just make it clear that these two provider types and our long-term care agencies, such as our nursing home, a nursing facility, they are another user that has access to harmony. If you're an agency that offers personal care services and home and community-based waiver services, you will only be able to access clients that have personal care services as your that's the main way that you'll be able to access files in there. And a reminder that if a provider does chore and or personal emergency response system, and they're not a PCS agency, and they're not going to be a Harmony user. Okay, we realize that those are services available within CFC, but they are not going to be users in Harmony. Okay. Anything to add to that, team?
No, I think you covered it, Kara. And those questions come up. We've gotten, I think, an influx of questions recently about this provider can't access the consumer, or what do they have to do to get that? So I'm so glad that you clarified. And if you have those questions, please ask them. We're never tired of answering questions, guys. So.
Hi, Delight. Did you want to add? Welcome.
Thank you. I had some difficulty getting in today, so I'm so thankful we have like a solid team to be here and be there for you. I think the biggest thing is that if you have access to cases in Harmony, you're only really able to look at and should be doing work within your role in Harmony. So if you're a PCS admin, but you're serving clients that also receive waiver services, just because you may happen to see it doesn't mean that you are going to be active with that in that role. So an example is like you're a PCS agency, but you also offer chore. You may be able to see that client's case, but you're only working in Harmony in that PCS role. There's a separate, like, care coordinators work on home and community-based waiver services within Harmony. So that's really just something to kind of know, is that just because you may have access because it's a combo case doesn't necessarily mean that you have, it doesn't mean that your role changes to work on home and community-based services in Harmony. You're going to do that with the care coordinator when you're doing planning team meetings and delivery of service and collaborating, but you shouldn't be using Harmony to facilitate that, to be working on it in that kind of context. So you, as a chore provider, you wouldn't go in and do anything in Harmony with chore, right? That you wouldn't go in and do that. That's just for care coordinators. Hopefully that gives some clarity. We have had some questions about that.
Sure. Thank you, Delight. Yeah, and always ask, don't feel like you don't have access to the answers. We welcome your emails. It's the best way to get a hold of us, sdstraining@alaska.gov. So we're always there for you. We also have provider office hour every week. That's on Thursdays We have our open office hours. So if you have particular questions about cases and you want to discuss those questions with us, we are available to you. I don't have the link handy here. I could probably go grab it and throw it into the chat there. But just as a reminder, you can always
I'll
join us
grab
on
it.
Thursdays. Okay, it's Thursdays 3 to 4. Okay. All right. So our next agenda item is about traveling outside of your home community and using services. So if a person wants to use services while they're outside of their home community, what does that look like, and what are the typical questions and concepts we talk about this time of year? People are starting to plan travel in the nice summer months. So just a couple quick reminders. The biggest reminder really is to work with the person's care coordinator regarding services outside their home community. And if they don't have a care coordinator and their service provider is personal care services, then you would work with that agency for that change. So services that are in general available to people while they're outside the home community: personal care services, residential habilitation supported living. Let me check my regulation here just to make sure that I'm getting them all. Might be missing a few here, but I can go ahead and grab that. And basically, we want to remind us that to work ahead if possible, ahead of time. Here we go. Here comes the actual list. I'll show you that. You get my screen all situated here. And this is for, this is a waiver regulation. So this is pertaining to waiver, all right? Services during temporary absence is what it's called, okay? So for PCS is separate. We already understand PCS is available. Day habilitation, supported living, in-home supports, hourly respite, adult day, and employment services, okay? Those are all potentially available when the person is outside their home community. For adult day, here, I'll talk about what the outside the home community means in general, okay? So outside the home community means the person is going to be needing services in a place that is either within Alaska or within the United States, okay? And if they're in Alaska, it is a place that's outside of their home community, and generally it is a place that's far enough away that you would not go there and come back in the same day. Like you wouldn't commute there, you know, it wouldn't be a same day trip. It would be where you would travel and stay overnight and then stay and then come back. Okay, so it's not a next to you community. It's a place that usually people don't go and come back in the same day. Now I know it's possible to go a place and come back in the same day by plane and things like that. But generally people wouldn't do that. They wouldn't really, you know, commute to another place by plane in the same day as a trip, okay? A regular customary thing. And then within the United States, so the Medicaid home and community-based waiver is not authorized to do services, reimburse services outside of the United States, right? So the person needs to be in the United States during the time that the service is given, okay? For adult day, this one here, it's interesting because adult day has its own set of regulations around the location where it is certified, and the person has an activity plan and things like that. Adult day is really just meant for locations in Alaska. The intent of it is for locations in Alaska. So if somebody is an adult day customer, if you will, and they normally live in Fairbanks and they want to come to Anchorage and go to adult day while they're here, then that's okay. That would be a services while outside the community request. We don't have any certified and enrolled adult day providers in the lower 48. So it really isn't that kind of a scenario at all. It's really just for choices in Alaska, right? Okay, a couple questions here. For a doctor's appointment in Anchorage from home or where there is an overnight stay, is that subject to prior authorization? So I think your question needs a little bit more clarification. A doctor appointment is in the realm of medical travel rather than waiver. Okay, so that would be a question for the medical provider about transportation for a doctor's appointment. Okay, this is not waiver transportation. Everything that Medicaid does is subject to prior authorization. Okay, everything that every insurance company does, every health insurance company has to prior authorize a procedure. Okay, so all these things that we do and request through the waiver, yes, they are person-centered. Yes, they are about helping people live a regular life of their choice in the community as others would in their community, should they not experience a disability. But on the Medicaid side, everything has a procedure, everything has a procedure code. So hence everything is subject to prior authorization.
Hey, Kara, if I could just
Yeah.
jump in before like things get too wild. So big things to factor when we're evaluating travel. What services are going with the person? Because it depends on the service if it can all, or there are other factors in the request. So PCS has its own requirements, must be approved in advance before travel can be authorized. Different than the habilitative services that could possibly travel with a person. So that's a really big part of kind of scoping out what you're requesting, mapping out what services are going to travel with the person. And if you're taking habilitative services, there's a lot of additional thoughts that have to go around that, such as, like what skills are we working on while we're doing that? So when we kind of post some of these what if questions in the chat, it's hard for us to answer because there are so many variables to the situation. So it's really best if you have concerns about a travel, do just come to office hours so that we can talk through, what services are we requesting to carry with us, carry along it for continuity of care, and will that is it allowable? And then as far that's really kind of the big like frame up I wanted to do before we got too much further, is that we have to be really clear about which services are going to be leveraged across that travel experience.
And the next question is a good segue to that. It says, going camping within Alaska for a couple days or a few days, does it require an amendment? How does the home go about getting it approved? So what I'm assuming here in my thought process is that this is a group home or, a residential setting like that. So the home doesn't get it approved. The individuals ask their care coordinator for support, during that time. And it needs to be one of these services here that they receive. And it's a lot of times when we get the same questions year after year, we've worked with folks for many years. It is not always possible to put together 24 hours of supports for these services listed here when a person is out of their home community, because the service has to, the work being done has to meet the requirements of each of these service types, right? So it's not just oversight and, a 24-hour unit of making sure they're okay. They have to have goals and objectives that they're doing through day habilitation, if it's that. Supported living, if it's that. Hourly respite, in-home support, sorry, hourly respite does not, carry with it goals and objectives, but it needs to be respite of a unpaid caregiver. So usually people who don't have, not always, but check and see if the person has an unpaid caregiver that would be receiving respite in their, that these are things that a care coordinator would work with the person about to see how that might work. Question about group home residents outside their home community with 24/7 staff providing one-to-one supported living with prior authorization approved in an amendment. Can the resident receive the maximum 18 hours a day of supported living habilitation? That I'm unable to verify that as a yes or a no answer. This has to be requested through the care coordinator, and an amendment is a good way to do that, is the way to do that. And again, it has to make sense for the service and for the person. And these services are, they're specifically for goals and objectives. So that would be a question for each person towards their care coordinator. And of course, you're involved as a provider. You would help work that out in a planning team about what that would look like. A couple questions in the same sort of vein. What is the process for receiving prior authorization for HAB services to be offered outside of the primary residence during travel? It's going to need to be one of these services here that we have where you can see the dot, right? They have supported living, in-home support. Of course, our in-home support is only for our people under age 18. So if you're talking about a residence, it's going to be 18 and over. So it's going to be day have supported living, in some cases adult day, and in some cases employment. But you would need to work directly with the care coordinator about what services could potentially be provided, and following, helping that person achieve certain goals within their day. Generally, the HAB services aren't for recreation and leisure. So I get that people do that and they receive recreation and leisure. This is my frame up of trying to explain that because a group home is a 24-hour service, then it's not, we shouldn't assume that 24 hours or close to it would be done by other services, right? It's a case-by-case scenario, really just related to the purpose and intent of the service itself and what's available to people. So yeah, receiving prior authorization really is just like a farther journey than just asking and receiving. It's a good talk with the care coordinator about that, about what's the person expected to do. Are they going to, spend some time chilling out, and what does that look like, and what are the goals look like? Putting together a reasonable experience for them with the support of staff while they're outside the home community. What else to add to this? Go ahead, team.
Just to clarify, if someone wants to go on activities like camping with their family without, services, we wouldn't expect an amendment for that, right?
Good point.
Yeah. So if someone's like, they are going to go do something in Alaska and they're not taking services, it wouldn't be something that would be an amendment. It may be a planning team like connection to be like, hey, don't expect, this person to go do an activity because they're gone. That might be needed, but it wouldn't be something that we would need an amendment for that specific event, unless services were going with that person.
Did we get all the questions? Kind of.
There's a question about how soon before travel do you have to submit an amendment?
Well, the amendment regulation requires it within 10 days, but you can send it in before that. So within 10 days of the change or ahead. Really just it's a care coordinator. It's part of the care coordinator's art that they do. Okay, so I just really want to emphasize, working with the care coordinator regarding that. As soon as you know, in some cases, they may be able to have traveling out, getting services while outside the community, the home community, as a regular thing in a plan. If a person really just knows that they're going to go someplace every year, there may be some ways to sort of make it easier with the changes and things like that. We know the times ahead and things like that, but people don't always know that, so that's okay too. Mostly just working with the care coordinator. All right, staff, we're going to work applicable supported living or DAHAB goals during a conference, like peer power. Would that require an amendment? It requires an amendment if the person is going to be receiving the service outside of their home community in a place that is like not a day trip. They traveled farther than they would customarily would not go and come back in a day. So it's really just about the service and where it's at. And again, we encourage you to come to our either care, if you're a care coordinator, of course, come to our care coordinator office hours. And if you're a provider, come to our provider office hour, and we can certainly go through different cases with you. This question says, what if a care coordinator is notified less than 10 days or right before the travel plans have them leaving? That is why you can do 10 days before or 10 days after the change. All right,
I think that's,
go ahead.
yeah, I was
Sorry.
gonna say, like, providers, if you are catching wind that travel is going to be happening, just let that care coordinator know as soon as it's casually brought up so that, the ball can get rolling. It does take time to get these pieces all put into place. So it really helps if we collaborate ahead of the game. I guess that's really what we hear often on the end point at SDS is, well, we didn't know that the provider and the client had made a plan to go camping until it was like the bags were packed. So I think that might be part of one of the ways that we can collaborate better together. And I know it's really difficult because of just how frantic Alaskan summers are. Like, I just don't think that Alaska's culture is like really mapped with CMS on like how like it's not uncommon for someone to go from Homer to Anchorage in a day, but are they technically the same community? No, they're very different. So there are some dynamics that are unique to Alaska that pose real complexities for travel. So what can we tell you? Gosh, just do your best, really. We know that you're trying and you want to do the right thing. And the real important thing is to make sure that your person that you're serving safe. That's like number one. Just do your best to work together as a planning team to communicate. And if you're having some stumbling blocks on how to plan for services to carry over with the person, you're not alone in this. Please reach out to us. It is really complex. And so when we teach it, we have a really hard time talking in these like really vague scenarios because, gosh, there's so many different reasons why people travel, ways people take services with them. The types of services that they currently use may change just for travel because of just the dynamics of the services they use. There's so many possible scenarios. So the best thing that we can tell you is do your best to work together. And when you feel like this is just over your head, please reach out. And training has experienced that as well, where we helped teams like try to figure out, and it's just complicated, and we have to pull in programs and ask them like, how do you want us to turn this in? Because this is
Yeah, we're willing to help and
complicated.
give info. And also a great reminder came in from one of our care coordinators is that if it involves personal care services, then the work has to be done 30 days ahead. So we've been getting questions here so far, mostly about the they were all about the HAB services. So if it involves personal care services, then 30 days ahead is the rule for personal care.
It's not a bad take to just try to do that for everything and try to do 30 days
True.
as much as you can. If you were going to take away a number, I would take away 30, because that's a requirement for PCS, and that's plenty of timing for an amendment. So if you're going to have one number stick, 30 days would be the best number to hang on to.
Okay, good discussion. Let's take a look at our agenda again. Next discussion topic was May 11th being the declared end of the public health emergency. And so May 11th is around the corner. We just want to acknowledge that it's the declared end of the PHE, but there's just no way to summarize the impact and ongoing complexities around the flexibilities and what's changing, what has changed in people's lives and how it impacts real people's lives. I'm not proposing to, make anything other than open-ended reference to this here, and just give a few simple reminders that have gone out by e-alert. And just to acknowledge that we're all working on getting information out as fast as we can, and getting questions answered, and listening to a lot of questions. And, a lot of the changes that have ended up being ongoing through flexibilities made permanent were from discussions, and you can expect, more discussions and more information to come out. We just didn't want to let today go by without a quick reminder of what has gone out. Then there was a suggestion of, all right, let's get to it. Okay, so I want to call attention to the fact there's two different sort of categories here. One is waiver and one is PCS. So the flexibilities for waiver, right? Waiver flexibilities for waiver services are able to be extended 6 months after the end of the declared end of the PHE. So that is in November of 2023. For personal care services, those are not extended past May 11th. Those flexibilities end on May 11th. And if you've watched your e-alerts, you probably have seen a few different reminders go out around that. And if not, I'm sure you'll see them again. It's okay, because what I'm going to do now is, for us here, I'm going to show you how to find those e-alerts, and hopefully I can find it myself first. Let's do that. That would be a good thing. All right. Let me make it bigger. I'll show you how to find them, and they're fairly recent in the list, so it's not too difficult to find them or re-find them, if you will. A question said, will additional respite hours end after May 11th? That is a waiver service, so the additional respite hours flexibility is ending in November. Okay, remember, there's two things, the PCS and waiver, they're different. The flexibility is associated with PCS and some other services that aren't really in our zone were ending May 11th, and they put them out on an e-alert, and the waiver services are ending in November. So let me go back one, and I'll share my screen here. Sorry. All right, so this is our main web page, right? SDS web page. If you go down to the bottom of it, or at least if you look on the right-hand column here, the bottom of the right-hand column, and just look for my Spotlight e-alerts, right? You can sign up for them if you haven't, or if you have a new address that you want them to go to or something, sign up. But what we're going to look at is archived e-alerts, right? So we're going to look at archived e-alerts here. And it brings you to a big list. And I just go by thread, by subject is okay. It's hard to tease out a title if you're looking for, you know, larger threads of information. But for today, let's just look at the last month and this month. Okay, so the purple ones are ones that I already clicked on. For whatever reason, it'll let you know that you already clicked on it. But we do have waiver flexibilities ending, update to state plan services ending on May 11th, and state plan service flexibilities ending in 60 days, right? And then, let's see, and sometimes they issue a correction, so you might see them related like that as well, okay? A lot of the different, you know, announcements that have gone out. So let's look at this one. Okay. All right. After May 11th, the section 1135, which is related to PCS flexibilities, will no longer be available for personal care services, CFC personal care and chore, and long-term services and supports targeted case management. So we have allowing the services to be provided in alternative settings via telehealth using distance delivery technology, except as permitted in 110.635, which is our telehealth regulations, allowing the services to be provided without the direct support professional employee to have proof of first aid and CPR on file. All right, so proof of first aid CPR will again be required. The conditions of participation have been amended to remove the hands-on skills check required for CPR. So all first aid CPR training can now be entirely online. Right, so this is addressing the PCS related services. All right, so if we go back, this one is talking about Appendix K amendment covering all 5 of the waivers, right? This is like a reaffirmation of 1135. So what flexibilities will end on May 11th? Flexibility to receive additional chore, additional payment of monthly targeted case management, infant learning, flexibility to pay legally responsible individuals to provide the following services: personal care and community first choice, meaning personal care and chore. All right, so I'm going to go back. And so let's try this month.
Hey, Kara, sorry.
Yes.
On the last e-alert on the March month had the very bottom one.
This one here.
Oh, I'm sorry, I might be mistaken. We do have one where it has the FAQs attached. They were like circulated with frequently asked questions. So I'm trying to figure out which one that is. So I might have just misspoke.
That's okay.
It's the March 17th one.
Which one?
March 17th. But I don't know if the archived versions have the attachments, but.
Yeah, the archived ones don't have the attachments. That's the thing.
which is what you really would probably benefit the most from, is the frequently asked question, which we can drop into the actual webinar as a handout that you can grab.
Yeah, let's do that. What day was that one sent? I could probably try to find it too.
Oh, I'm doing it now. I'll do it now.
Oh, okay, good. Awesome.
She's on it.
Yeah, it's, you know, it's really best if you're signed up for these and you get them, you know, sent to your email, because it's the easiest way to look at it, and if you can keep track of it. But you can always use the archived ones too. I'm not saying it's not useful. At least it helps you remember, you know, as it came out and when it came out and things like that. All right. So now Delight and Kat have, I can't remember which one of you added that just now. FAQ, flexibility
Kat did.
lending. Okay, thank you,
Kat got
Kat. All right, awesome. Thank you. Let me see if I can grab that.
That might be helpful to
Share
walk
it.
through, because it's concentrated on what's going down on May 11th, what turns off, because we do know that it's kind of a lot to wrestle through each one of these messages separately when you kind of want to look at the whole.
Okay.
So this is kind
Yeah.
of but you should, like, every single one that Kara showed you, that was kind of your official notice. Like, those were SDS's official notice that they were ending. They're really important for you. If you're not signed up, you really need to be, because that's your official notification about specific actions. And so this is a handy dandy sheet to help you with that. Was kind of looking at it from a higher view, I guess.
Yeah. So if you're able to download something on the device you're attending our webinar with today, you can download this. If it's a phone or whatever, or some, you know, device that doesn't download things, that's okay too. It's available. If you receive the alerts, you probably would have gotten it. We can also send it to you. It's no big deal to send it out as well. All right. This will help with a few things. Okay, let's take a look. Right. Let me move things so I can see things here. All right. Public health emergency ending, declared end on May 11th. All right. Most of the flexibilities are with the state plan services. Alaska cannot continue those flexibilities, right? That's what I was trying to talk about with personal care services and community first choice. What ends on May 11th? Legally responsible individuals being paid to provide personal care and CFC chore and personal care under CFC, okay? So that would be a parent of a minor, a spouse, or a legal rep, unless their current guardianship decree authorizes payment to them to be paid to provide personal care. That ends on May 11th. A person should talk with their provider about that regarding their needs for service. What actions can be taken to continue to pay a parent of a minor? So a regulation does currently, or after May 11th, will take effect that prohibits, once again, parents of minors to be paid to provide services to those minors. What should a legal guardian do if they cannot find another DSP to provide care? It's possible to petition the court to change the guardianship decree. That would be done through the court process. And then there's a resource there for guardianship questions. ASAGA is pretty great about that. And it has a link to an e-alert for more information. Targeted case management for ILP. This is for ILP providers only, okay, not super duper related to our audience here. Verbal attestations to authorize or agree documents. Well, they're accepted through May 11th. After May 11th, signatures are required. Do we need to get signatures for those attestations? Yes, collect signatures that include verbal attestations. It's an expectation since the flexibility was implemented in 2020. Where should I file a document after it's been signed? We are not requiring these documents to be resubmitted. but keep it on file with the provider. You may be asked to produce those records and keep records as always for 7 years. What should I do if the person that attested the document is no longer available or isn't a client? Document why the signature is not available and keep it on file with your agency. A flexibility made permanent includes electronic signatures, which is an e-alert going back to February 2023. And that's a link in this document as well. It's pretty helpful. Additional chore will end May 11th. What if there are other medical situations that require additional chore? File an amendment to request an increase in a service, provide the details about that need. Required medical documents. When will SDS start requiring again that medical documents be submitted with applications? We're going to require medical records, QDC, and VODs for all applications beginning May 12th. And this was referenced to an e-alert also on February 24th, 2023. What if there are problems getting medical documents? Care coordinators and PCS administrators, you cannot get medical records from a provider prior to an application deadline, file a report with centralized reporting that would go to our QA unit, give details about the dates and times that the records were requested. Settings restrictions about visitors. This is in assisted living homes. When will the flexibility to restrict outside visitors from visiting recipients in assisted living homes end? It's ending on May 11th. Starting May 12th, visitors will no longer be restricted from visiting homes in assisted living, or visiting recipients in assisted living homes, according to settings rules. And then the first aid CPR, we did sort of talk about that just now. DSPs will be required to have proof of first aid CPR in their employee files, and the flexibility ends May 11th. People are able to take these courses fully online. Simultaneously ending the flexibility for DSPs who provide waiver services to align with the end of the public health emergency on May 11th, because we know that many DSPs work both waiver and PCS. It would be pretty complicated to track that for DSPs if it was 2 separate dates. So thank you for providing this for our reference here. I'll go up to the top of it and take a look at our questions here again. Okay, a question said, can we confirm the date? Hang on, try to make it big enough for me to see. Can we confirm the date that agencies are required to have the new National Certificate in Employment Services training? All right, it's a work in progress. At this time, this training is expected to be completed by support employment administrators by November 11th, 2023. Staff should complete their NCES training by November 11th, 2024, 1 year after the flexibilities end. All right, sign up for e-alerts. Make sure that you can stay posted with us on that. Was there a decision continuing care coordinator visits face-to-face and through virtual means? Care coordination visits are part of the new regs that came out about flexibilities made permanent, and they are available to be done through distance delivery modality, telehealth modality. That is currently acceptable now and will continue to be. Under our new regulation that will be implemented, a care coordinator will need to do a face-to-face visit once every 6 months. And the other visits can be either face-to-face or in, by distance delivery modality, according to the person's needs and preferences. Online CPR okay after May 11th? Yes, it is okay. All right. What else to add? Thoughts, team? Go for it.
It's a lot of changes. That's my first thought. It's a lot of content. So if you're feeling like a little overwhelmed by all of it, it's okay. We just come back and look at this document. Try to download it from the chat if you can right now, and then reread it at a different time so that you can see what's applicable to you in your practice, your agency's practice, because it's a lot. And it's a lot of shifting in a good way, right? We're glad the PHE's over, but it's a lot of logistics to manage, right? So we understand that.
Mm-hmm. Yeah, it's a big change. And we still work with people who have health concerns, and people can still get sick and things like that. It's just none of us have really been through this before, so we're not familiar with how to do these things. But we do want to share the latest and greatest information with you and the requirements with you. So in order to be helpful in the work that you do, supporting people in our communities. This is coming up on the top of the hour. So if you want to type in your last minute questions, I would say go for it. And then we can close our session. We definitely encourage you to download this if you can. You can maybe make a collection of e-alerts too for yourself if that helps you. You can always go back to the archive list and see if you can identify the topic that you're looking for. Then you can search for it in your emails if you are signed up. And then if you're not signed up, well, we showed you where you can go ahead and sign up. So we know that our providers are required to sign up. Our certified providers are required to do that. But if you're not getting them, then you probably want to check why. Check your spam folder or your unwanted mail folder. Allow it as a sender, or maybe just register again.
Kara, I put the e-alert sign up in the chat as well.
Oh,
How they
great.
can
Thank
go
you.
to it to sign up.
Very helpful. Very helpful. Thank you so much. Yeah, that's great.
And make sure you sign up for the Academy, the CEH that's about provider certification, renewal periods and variable renewal periods. Can you imagine having 2, 3 years between certifications? That's a real thing now. Please check out that training that's coming up. I'm working with PCC on it, and that's going to drop in the next week or two. So get into the Academy.
I'm putting the link to the Academy in now as well.
Mm-hmm. Yes, everybody sign up if you haven't already done so, and check back go to your account in the Academy. And if you see a training listed that you want to take, but it says you can't self-enroll, why all you have to do is send us an email, sdstraining@alaska.gov, and we'll enroll you in it, as long as it makes sense for you. If you're not a Harmony user, then we won't make you take Intro to Harmony. But there might be other trainings there that you need permission to enroll in, and we'll just go ahead and open that for you. Right? Have the requirements or Appendix K regs for requesting additional respite changed? No, not yet. Those are going to end in November, 6 months after the end of the declared end of the public health emergency. So it has not changed yet. All right, so it's at the top of the hour. We'll go ahead and call it for today. I want to thank my team, Kat, Delight, Cassandra, Anna, and our newest member, Damon. Thank you to all of you for helping get this great information out to people. And thank you to those who came to our webinar today. We really appreciate you and the work that you do. Join us in office hour if you can. And if you have case specific, don't forget that we're there for you. And we hope you have a wonderful afternoon and a great rest of the week. Take care, everybody. Bye-bye for now.
Thank you.
Bye.